All right, good afternoon, everyone. This morning, the state of New Jersey filed a 5-count lawsuit against Janssen Pharmaceuticals for its role in fueling the opioid crisis in this country. We allege that for years, Janssen, a wholly owned subsidiary of Johnson & Johnson, aggressively and deceptively marketed its prescription opioid products to the people of New Jersey, knowing full well that its products carried a high risk for addiction and for abuse. Today, we're holding Janssen accountable. Our 97-page complaint is the culmination of a lengthy investigation into Janssen's marketing practices. Our lawsuit details a years-long scheme designed to deceive doctors and patients about two of the company's opioid products, Nucynta and Nucynta ER. As the complaint makes clear, Janssen went to great lengths in its efforts to mislead the public. Among other things, we allege that Janssen masterminded a public relations campaign to undermine accepted medical practices. It used a network of sales representatives to push its misleading marketing. It quietly funded front organizations that peddled its bogus medical theories. And it even went so far as targeting elderly nursing home and hospital patients with its misinformation. And here's the thing, Janssen did all of this in an effort to increase its bottom line. And although these products generated significant revenue for the company over many years, Janssen cashed in one last time in 2015 when it sold the rights to Nucynta and Nucynta ER, collecting more than $1 billion in the process. And it's especially troubling that so much of the alleged misconduct took place right here in our backyard. New Jersey's pharmaceutical industry is the envy of the world, with a long history of developing vital, life-saving drugs. But we can't turn a blind eye when a New Jersey company like Janssen violates our laws and threatens the lives of our residents. Now, Paul Rodriguez, the director of our Division of Consumer Affairs, will provide additional details about the allegations in our complaint, which was filed in Mercer County Superior Court earlier this morning. But broadly, the complaint alleges violations of the New Jersey Consumer Fraud Act, the New Jersey False Claims Act, and the common law prohibition against the creation of a public nuisance. As for the remedies that we're demanding, we're seeking a judgment requiring Janssen to pay the public for a crisis it helped to cause. And we are demanding that the company pay civil penalties and disgorge its ill-gotten gains. I want to say one more thing about our complaint. As you'll see, it contains numerous redactions. And here's why. The complaint is based on evidence of wrongdoing uncovered during our investigation, including evidence found in internal company documents, documents that were never previously made public. Court rules required us to black out this information, but we believe that the public has a right to see the full complaint. So today, we also requested the court's permission to make all of our allegations against Janssen public. And we're calling on Janssen to join us in that request and not oppose it. Because the fraud orchestrated here by Janssen harmed all of New Jersey has a right to know about what the company did. New Jersey has suffered in so many ways because of the opioid crisis. Lives have been lost, families have been destroyed, and futures have been darkened. At the Attorney General's office, we're doing everything we can to end this crisis and to hold accountable those who are responsible for causing it. And we have many different tools for fighting the opioid crisis. Through our Division of Criminal Justice, we're prosecuting those who traffic in fentanyl and heroin. Through our Division of Consumer Affairs, we're seeking the revocation of professional licenses of those who recklessly prescribe these opioids. Through coordination with our county prosecutors across the state, we've launched Operation Helping Hand to divert addicted individuals into substance abuse treatment. And through our divisions of law and consumer affairs, we're bringing cases like the one we just announced today. And earlier this year, I created a new office called the New Jersey Coordinator for Addiction Responses and Enforcement Strategies, or NJ Cares. The purpose of NJ Cares is to ensure that we deploy all of the tools that I just outlined, as well as many others, in a coordinated and targeted way. You'll be hearing from Sharon Joyce in a moment. She's the director of NJ Cares, and she'll speak with you about some of those efforts. As all of you can see, much is being done, but clearly there's much more to do. And we're committed to doing whatever it takes to stop this crisis. This is the third opioid case that our office has brought against a pharmaceutical company. But it's the first one that we've brought against a New Jersey-based manufacturer. And with today's complaint, our message is clear. If you violate our laws, if you illegally push opioids for profit, we will hold you accountable, no matter who you are and no matter where you operate. We'll hold you accountable whether you're breaking the law on a street corner, in an exam room, or in the corner office. As we trend towards over 3,000 opioid deaths in this state this year, the residents of New Jersey deserve nothing less. Let me close by thanking the incredible team that put this case together. Assistant Attorney General Kevin Jesperson led the team. He's one of the finest lawyers in our department. I want to thank Assistant Attorney General Janine Matan and Deputy Attorneys General Jesse Serrant, Patricia Sharippo, and Brian DeVito. I also want to thank the law firm of Cohen, Milstein, Sellers, and Toll, which we retained to assist us in this litigation. With that, I'll turn it over to Paul Rodriguez, our Director of the Division of Consumer Affairs, to discuss details of the complaint, and then Sharon will make some remarks and we'll answer your questions following her remarks. Director?
Thank you, General. Good afternoon. In filing today's lawsuit, we seek to hold Janssen Pharmaceuticals accountable for its contribution to the opioid crisis that has led to the addiction and death of far too many of our loved ones and neighbors. For years, Janssen employed a deceptive promotional scheme to create a market for its Nucynta line of opioid products. As part of this campaign, Janssen routinely portrayed Nucynta and Nucynta ER as being unlike traditional opioids and as having non-opioid properties. Janssen's representatives promoted Nucynta and Nucynta ER as safer, milder, and less addictive than competitor opioids like OxyContin. But Janssen's statements were unsupported and misleading. There were no valid clinical studies to prove their claims. In reality, Nucynta and Nucynta ER are not milder and are not less addictive than competitor opioids. They are narcotic drugs that have a high potential for abuse, like other Schedule II narcotics, like OxyContin and fentanyl. From 2009 to 2015, Janssen blanketed its home state of New Jersey with an intense campaign, which included a staggering number of in-person sales visits to deliver misleading messages to New Jersey prescribers with one goal: to get them to prescribe Nucynta. Janssen also created and implemented an unbranded marketing campaign to capitalize on and perpetuate existing deceptions about prescription opioids. Their aim was to persuade prescribers and patients that the benefits of long-term opioid use for moderate pain greatly outweighed the risks. As part of this campaign, they deployed a speakers bureau of practitioners paid to encourage healthcare providers to prescribe opioids generally and Janssen products specifically. As part of their deceptive campaign, which you can see examples of on the boards here today, Janssen overstated the benefits of opioid use and omitted or trivialized the risks associated with chronic opioid abuse. They exaggerated the risks of over-the-counter pain relievers like aspirin and ibuprofen, including possible internal bleeding, heart attacks, or strokes. They deceptively described opioid use as rarely addictive. They routinely promoted the scientifically discredited concept of pseudo-addiction and recommended even higher and more frequent doses of opioids to overcome the symptoms of addiction. And they intentionally targeted New Jersey's elderly with its deceptive statements, even though opioid use among seniors carries heightened risks of overdose, injury, and death. Published brochures and videos aimed at the elderly, as well as their caregivers, recommending that all patients experiencing diminished quality of life due to pain should be considered for opioid therapy. These statements were deceptive and unsupported by the scientific evidence. As part of this extensive campaign, Janssen created unbranded websites with videos and other publications, including the Prescribe Responsibly website, which remains active today, the Let's Talk Pain Coalition, the Finding Relief campaign, funding multiple front groups to encourage the acceptance and use of opioids in pain treatment. Janssen had no scientific basis to support these deceptive statements in these publications. To the contrary, Janssen knew full well, as the CDC recently confirmed, that, quote, there is no good evidence that opioids improve pain or function with long-term use, unquote. Janssen was well aware that Schedule II opioids have a high potential for abuse. Most patients receiving more than a few weeks of opioid therapy will experience withdrawal symptoms, including severe anxiety, nausea, headaches, tremors, delirium, and pain. We know that Janssen's aggressive and deceptive promotional campaign contributed to the opioid epidemic by spreading misleading information designed to expand prescription opioid use into contexts in which such treatment had not traditionally been accepted. Janssen's focus was always profits. After Janssen created a robust market for its Nucynta and Nucynta ER line of products through its deceptive marketing campaigns, it sold its interest in 2015 for over $1 billion. We all know that opioid prescribing and opioid overdoses have ballooned across the country and in New Jersey. Janssen's deceptive conduct, which substantially contributed to and perpetuated the opioid crisis, violated the New Jersey Consumer Fraud Act, the New Jersey False Claims Act, and the common law prohibition against the creation of a public nuisance. As a result, we are seeking an order requiring Janssen to cease all unlawful promotion of opioids, correct its misrepresentations, abate the public nuisance that its deceptive marketing has been and has been a substantial factor in creating, and that Janssen pay civil penalties, restitution, and damages, submit to an accounting, and disgorge all ill-gotten gains, and reimburse fees and costs as permitted by the statutes alleged to have been violated. The public has a right to know the facts in this case. As the Attorney General mentioned earlier, Janssen has claimed that many of the key facts are confidential, proprietary, or trade secret information. This has required the Attorney General to file portions of the complaint under seal. We are asking Janssen to agree to unseal this complaint. If they don't, we will seek an order from the court to unseal the complaint so that the public can see the full scope of Janssen's conduct. Janssen is located in New Jersey, and its marketing of opioids to New Jersey patients and doctors was deceptive and unconscionable. Janssen has substantially contributed to and profited from the opioid epidemic in New Jersey. This lawsuit will ensure that Janssen is held accountable and that they help to remedy that epidemic. Thank you very much. With that, Sharon?
Good afternoon. The lawsuit announced today represents the latest action in New Jersey's comprehensive approach to combating the heroin and opioid addiction epidemic in our state. When Attorney General Grewal appointed me to lead his newly created Office of the Coordinator of Addiction Responses and Enforcement Strategies, or New Jersey CARES, last February, his mission to the office was clear: to coordinate and facilitate an addiction-fighting strategy as broad in scope and intensity as the opioid crisis itself, to create a plan of action that uses all relevant authority and resources within the Department of Law and Public Safety to identify and implement solutions to the opioid epidemic, and broadens the reach and impact of those resources by partnering with outside agencies and groups similarly committed to fighting this deadly health crisis. New Jersey CARES has responded to that call by coordinating and overseeing a multi-departmental strategy to fight addiction from every angle. As others have mentioned, we are holding accountable those who fuel the crisis. Within the Division of Law, we're suing opioid manufacturers who have misled the public about the dangers of opioids. The Janssen lawsuit is the third civil action we filed against drug makers whose deceptive sales campaigns helped spawn a new generation of heroin addicts. Last year, we filed similar lawsuits against Insys Therapeutics and Purdue Pharma. Within the Division of Criminal Justice, we're bringing criminal charges against the most dangerous opioid traffickers, aggressively pursuing those who illegally traffic heroin, fentanyl, and other opioid drugs, securing decade-long sentences against the worst offenders, as well as white-collar criminals who profit from the illegal diversion of opioids. Within the Division of Consumer Affairs, the licensing boards have issued orders revoking, suspending, or otherwise restricting professional licenses and CDS prescribing privileges of those who provide opioid medications without legitimate purpose and are blind to the red flags reflecting possible diversion. We're also facilitating treatment and recovery services for those who need them most. We've engaged law enforcement to connect individuals suffering from addiction to treatment and recovery services by working with county prosecutors to take the program that the Attorney General Grewal began as Bergen County prosecutor and expand it statewide. Operation Helping Hand, an innovative initiative that uses law enforcement encounters as a point of entry for treatment and recovery support services. It was replicated in 4 additional counties earlier this year, and we recently were awarded a $1 million grant to expand the initiative across the state. 17 counties have applied. We are also working to assemble opioid response teams, which serve as 24/7 efforts with teams of police, recovery coaches, and EMTs to help people in crisis in the 5 most in-need municipalities. And we're using data to solve problems, improve patient care, and educate the public. We have a $1.6 million grant to build an online dashboard to better target law enforcement resources. The Integrated Drug Awareness Dashboard, or IDAD, allows state agencies to share information on drug busts, overdose deaths, and naloxone deployments, as well as the number of prescriptions that are being dispensed, to better inform how we fight opioid addiction in the future and marshal our resources most effectively. We are also publishing data online to educate the public about the scope of the opioid crisis. The New Jersey Cares website provides the public with real-time updates on overdose deaths, naloxone administrations, and other opioid-related information on a county-by-county basis, allowing agencies and citizens to track the impact of the opioid epidemic on their own communities. We're taking other actions to prevent opioid abuse, addiction, and overdose deaths. Using federal grant monies, we launched an advertising campaign to raise awareness of Project Medicine Drop. The ads informed the public that 70% of opioid abuse starts with easy access to unused pills, and we've urged the public to help fight addiction by disposing of those unused prescription medications at a Project Medicine Drop site near them, sites that are available 24/7, 365 days a year. We are also forging partnerships with other stakeholders. Since the creation of New Jersey Cares, we've met with law enforcement agencies, healthcare professionals, addiction support and service providers, industry advocates, those suffering from addiction, families who love them, and families who've lost them. We're learning about what they're doing, how they're doing it, and what more needs to be done. Most importantly, we're identifying innovative ways to support and collaborate with them to better fight the opioid epidemic. There is still much work to be done. We'll continue to do everything we can to fight this battle, and together we will see an end to the epidemic. Not today and not tomorrow, but with every new program we put in place and with new and creative initiatives, we will save lives. I want to thank the Attorney General and all of our partners for their commitment to this battle. Thank you.
Yep, thanks, Sharon. Let me just say this. Sharon's remarks really highlight how an unprecedented crisis requires an unprecedented response that combines law enforcement and combines civil enforcement. It combines private stakeholders and industry coming together. And that's what NJ Cares is designed to do, and I want to commend her for really taking the lead on this over the last 8 months. Go, Mike.
You're seeking civil penalties, restitution, and damages from a company that it sounds like stopped engaging in this behavior when it divested itself of the drug in 2015. Is that correct?
That's right. I mean, it sold the rights to Nucynta and Nucynta ER in 2015 for $1 billion plus, but it's still responsible for the conduct that it engaged in for the 8-year period during which it marketed these drugs irresponsibly, as we allege, and we're going to hold them accountable for that conduct.
And how would you say it deceived doctors and patients?
Well, I think a lot of it was referred to in the remarks. They funded bogus research. They pushed bogus theories like pseudo-addiction, things that have been debunked. They said that they positioned Nucynta and Nucynta ER as a safer alternative to other more powerful opioid drugs, as the director mentioned, when in fact they were the same types of opioid drugs. So it's that knowing misinformation and the concerted effort to use sales representatives to make calls on doctors to push this theory and to have anonymous websites that are not linked back to the manufacturer here to appear as if they're independent organizations. Really the standard playbook that Purdue used and other pharmaceutical companies used to push forward this mistaken belief that you could treat chronic pain with these powerful opioid drugs, which is now widely debunked, and we allege they knew at the time was not credible science.
Did you know that, or has there been any indication that executives of the parent company, Johnson & Johnson, were aware of the marketing campaign?
So we did not name Johnson & Johnson in our lawsuit. Johnson & Johnson is the parent company of Janssen. We will begin the fact-finding process in discovery, and if we find information that indicates that the parent company, Johnson & Johnson, was aware or involved in the conduct of Janssen, then we have the ability to amend our complaint down the road, and we'll certainly do that if the facts lead there. Right there.
You mentioned a couple of times the $1 billion sale of this company. Do you in fact believe the state is entitled to that $1 billion?
We're entitled to our costs in treating this epidemic. We're entitled to the profits they earned from these products to their ill-gotten gains, and so we'll have a full accounting during the litigation as to what exactly that number adds up to. In the back?
The city of Newark, a couple months ago, last year, I guess, sued 11 companies, although some of them were repetitive, like two versions of it. Further lawsuits beyond these 3 that your office has filed over the past year, and of course, Teva is a bit controversial since the government ordered them to move their headquarters.
So as I mentioned in my remarks earlier, we'll hold accountable all the companies that were responsible for fueling the opioid crisis nationwide and for causing the crisis to spread in New Jersey. And our investigations are ongoing into different manufacturers. We took our time putting this particular case together. As you'll see, even from the redacted complaint that you have, the team here did a phenomenal job of putting this case together and running out this investigation. And we continue to look at other culpable entities as well. And so without going into specific investigations and naming names, we do intend to bring additional lawsuits in the future.
As a follow-up, would you say to your staff, hands off of any particular company that perhaps the governor ordered to come to New Jersey?
I'll repeat myself. We'll hold everyone accountable, no matter who they are or where they operate. And we held Janssen Pharmaceuticals accountable, a subsidiary of Johnson & Johnson, one of the largest employers in this state. And so we're not shying away from holding folks accountable. If they're culpable, we'll hold them accountable.
General question on another topic, if I may.
Let's stay on topic first.
General, can you talk a little bit about the practice here of creating, what appear to be pretty standard informational websites? What does the state allege are the responsibilities of these companies in terms of disclosure, and how did that not happen?
Right. So they had a series of front organizations. We detail some of them in the complaint, so I'll ask the director to walk you through the specific allegations with respect to this. And it was websites, it was societies, it was funding other types of research. Again, the same playbook we saw with Purdue was at play here as well. So, Director?
So you're right. As you mentioned, they did fund not only websites, but also organizations, hiding their connection to those websites. But that part of the misrepresentation is hiding their connection to these sites. But we're also, I mean, it's important to point out that some of the statements that are made on the websites are also, we allege are irresponsible and untrue and without basis in fact and without basis in scientific evidence. We had, for example, that we had talked about the allegations of that they were promoting the concept of pseudo-addiction. This is a concept that if someone is addicted and they're experiencing pain, what a doctor needs to do is prescribe higher doses of opioids. They also will discredit in websites like Prescribe Responsibly, on other websites, and in other of the front organizations that they were sponsoring. The company was promoting the idea that opioids should be used to treat chronic pain, and kept on diminishing the risks that were associated with over-the-counter medications as well.
Does the Consumer Fraud Act or other regs have sort of explicit language on how you should be disclosing like a website like this? Had they put a disclaimer in the footer, would you guys have less of a leg to stand on here?
Not with regard to the allegations that were false or misleading, and with regard to the amount of disclosure that they should have provided, that's something that would be a case by case analysis. But yes, a company could have provided more. They certainly could have provided more information as to who was funding these organizations and these websites.
Do you have information being distributed to patients? Is it doctors who were receiving speakers fees exclusively who were giving out brochures in their offices?
There were doctors who were paid to give speeches. There were doctors who received compensation in different ways. We had, some of the information, as we mentioned, was given through websites, through paying people to go speak to those physicians as well.
And the sales reps, the detailing, the practice of sending in sales reps, as the director mentioned, the number of visits. You'll see in the complaint how certain doctors were paid X number of visits and their prescribing habits were, Y. That's all detailed and alleged, as several examples are in the complaint. Yep.
Drug dealers in jail and put doctors in jail for sometimes protected, why not go after the executives on criminal?
That's an excellent question. We hold accountable all those we could hold accountable criminally. Like if there's a drug dealer pushing dangerous fentanyl pills or opioids on the street corner, we go after them. We're going in the exam room. Part of the problem here is the date of the conduct. We are here now in 2018, and some of the culpable conduct is outside the statute of limitations to charge criminally, but we can charge civilly. So we use whatever tools are at our disposal. Executives of Purdue Pharma have been charged criminally in the past in other jurisdictions. So we're not counting out any tools, but we're using the tools available to us now. Insys, the company that we went after, one of the manufacturers of Subsys, which is a fentanyl patch, a sublingual film that you're supposed to use for end-of-life care and things of that nature. We charged that company civilly, but their executives have been charged criminally in Massachusetts. So criminal charges are still being brought against culpable actors where they can be brought.
Other topic?
Anything else on topic? All right.
Just one final question. In the investigation you did, was there a particular reason why in 2015 they sold the rights?
I think there were a billion reasons why they sold in 2015.
Money that was not,
No,
and these are still prescribed drugs.
they're still prescribed drugs. It was bought. The rights were bought by Depomed at that time, and now they've gone on to other companies. But I can't get into the heads of the executives. I know they got $1 billion from the transaction at that time.
General, you mentioned that other jurisdictions are able to charge criminally. Is that something that's lacking in New Jersey?
No.
The legislature needs to act?
No, there's nothing. It's a matter of when the conduct occurred and when we've uncovered it. It's a statute of limitations issue. It's nothing that we're asking for a legislative fix. The conduct with the particular example I used was more recent, so it was chargeable. And the way that case shook out is Massachusetts had criminal charges and we brought civil charges.
How about
There are about a dozen pending lawsuits brought by states against Janssen. Okay, first off topic and then here. Dave?
Mr. Hose, I'm sure you're aware the State Supreme Court made a ruling with regard to the guide to calibrate the drunk driving
Right.
mechanisms, and it could mean that 20,000 drunk driving cases could get tossed out. Your reaction to that? Are you concerned about it? Is it troubling?
Yeah, so my answer on the specific opinion, which came out this morning, is we're still processing it, and we're still coming up with guidance for our county prosecutors and our municipal prosecutors who handled many of these cases. But let me just say on a broader level, we work too hard at the Attorney General's office across the state to build trust in our system, to build trust in the criminal justice system. So whenever and wherever it's undermined, it's troubling to me. And so we're working hard to restore that trust. That's one of the reasons we stood up the Office of Public Integrity and Accountability. And with respect to this particular individual, Sergeant Dennis, he's the subject of a pending criminal case, and he'll be held accountable. I can't speak more to that because it's a pending case, but we'll be issuing guidance shortly for our county prosecutors and the municipal prosecutors with respect to how to handle those cases. Yes, sir.
General, a new report from New Jersey Policy Perspective says the current protocol in place set by the Corzine administration for how law enforcement interacts with individuals it believes to be unauthorized immigrants is, quote, notoriously vague, unquote, and is no longer viable, especially given the current political climate. What's your thinking about whether or not you should be open to adopting a new directive?
I agree wholeheartedly with that conclusion. A 2007 immigration directive can't reflect the immigration realities of 2018. And as a matter of fact, we've been in the process of revising Attorney General Milgram's directive, the 2007 directive. We are nearing the end of that